Endometriosis, Sonata Rodriguez, Community and Public Health, Charles P. Holmes. Endometriosis is a hidden struggle women face, and the age it is affecting is getting younger. There has to be something done so that we can put a halt to ovarian cancer and the struggle endometriosis patients deal with, and so our daughters don't have to struggle with the disease. Endometriosis is a disease that affects more than 5 million women worldwide. It comes from the word endometrium, which is a tissue that lines the uterus or the womb. Endometriosis occurs when the tissue grows outside of your uterus, and at times it can be located in other areas in the body such as vagina, cervix, vulva, the bowel, bladder, or rectum, where it can cause more issues. It is often found on the ovaries, uterus, fallopian tubes, the tissue that holds the uterus in place, and outside the lining of the uterus. Often when it comes to endometriosis, many patients experience lesions. These lesions can occur in different areas and can cause all kinds of effects. The areas that are most common in these patients are on the ovaries, the fallopian tubes, on the pelvic side wall, the uteroscleral ligaments, the Kodak sac, the pouch of Douglas, the rectal vagina septum, cesarean section scars, laparoscopy scars, on the bladder, on the bowel, on the intestines, colon, appendix, and rectum. Endometriosis has no age limit and can occur as soon as a girl reaches puberty and starts her menstrual cycle. It comes with pain during a woman's menstrual cycle, but also when they are ovulating. Some women can mistake it as period cramps, but the pain from endometriosis can be worse at times and can be associated with the pain from giving childbirth. There have been many other medical issues that have been linked with endometriosis, such as allergies, asthma, and chemical sensitivities. It has also been linked to the autoimmune diseases, when the body's defense systems that fight illnesses start to attack itself, and that includes multiple sclerosis, lupus, hypothyroidism, chronic fatigue syndrome, fibromyalgia. Through exams, many of the women that have been diagnosed with endometriosis have had signs of ovarian cancer and breast cancer, which is a very common thing when it comes to endometriosis. There are many problems that occur with endometriosis, some of which are long-term pelvic pain that can interfere with daily activities or routines, large cysts in the pelvis that may rupture. There are some cases when endometriosis tissue may block the intestine or urinary tract. Cancer may develop in the areas of tissue growth. Many women with endometriosis have problems conceiving children. This has become a very known issue, and infertility has been sought with some of these women to help conceive children. But the women who have a mild case of endometriosis still have a chance at having children. There are those that have an laparoscopy done, which is a surgery done to remove any growths or scar tissue, and this helps with conceiving, but there is still a 50-50 chance that it can be successful. There are several methods that are used to help treat endometriosis. The most important is a watchful eye. It is important to keep track of symptoms and go for regular checkups for testing to make sure that there are no other issues that have arisen. Pain medication is the most common treatment due to the pain that the patient endures. Hormone therapy, such as birth control, has been one of the methods that doctors have brought into light due to the fact that endometriosis occurs during ovulation. So to stop this would ease the condition, but it does not always work, and some have to try experimental drugs to try and help. The last treatment that most doctors try to avoid is a hysterectomy. This is the one treatment the doctors will try to avoid, and due to this, they will try all other methods before it is considered. There are also those home treatments that some use to try and ease the pain, which all doctors will suggest are rest, relaxation, meditation, warm baths, preventing constipation, and use of hot, warm bottles and heat pads on the abdomen. When it comes to awareness, endometriosis has not been a disease that has been kept in the public eye, but there are still organizations that try and spread the word. One organization that has dedicated its time to help educate the public about endometriosis and provide advocacy and help fund research is the Endometriosis Foundation of America. They are here to help try and bring more awareness to women and young women of all ages. They strive to increase disease recognition, provide advocacy, facilitate expert surgical training, and fund landmark endometriosis research. They help run campaigns to inform both the medical community and the public. They also push on the importance of early detection and help to provide education to medical professionals and their patients.